Bye.
Hi.
Zulaikha, are you okay?
I don't know why, after I discharged, I had difficulty to breathe.
Maybe you have a nosocomial infections?
Nosocomial infection? I think I've heard that before. Can you explain more about it?
Nosocomial infections or healthcare-associated infections occur in patients under medical care. These infections occur worldwide both in developed and developing countries. Nosocomial infections account for 7% in developed and 10% in developing countries. As these infections occur during hospital stay, they cause prolonged stay, disability, and economic burden. Nosocomial pathogens include bacteria, viruses, and fungal parasites. According to WHO estimates, approximately 15% of all hospitalized patients suffer from these infections. During hospitalization, patient is exposed to pathogens through different source environment, healthcare staff, and other infected patients. Do you know how you can be infected? Or maybe you didn't take care of your hygiene while in the ward?
I think I remember. Actually, while I was still in the ward, if I'm not mistaken, the doctor coughed at me, and then he continued to treat me without even wearing hand sanitizer or glove. Can you imagine that?
Based on source that I get from the internet, there are few factors that contribute to nosocomial infection. Firstly is medication or treatment. For example, repeated blood transfusion make the patient more vulnerable to infection. Secondly is increased susceptibility. Evidently, patients who are admitted in hospital have poor state of health, which means lower defense quality against bacteria. This group includes elderly, premature babies, and immunodeficients. The third factor is invasive devices. For instance, is intubation tube, catheters, surgical drains. These devices itself have already overcome the body's primary defense line. Do you guys know any types of nosocomial infections?
There are 4 types of nosocomial infections. The first is central line associated bloodstream infections that have 12 to 15% of death rate. Catheters are placed in the central line to provide fluid and medicines, but prolonged use can cause serious bloodstream infections. Next, the common type of nosocomial infections is catheter-associated urinary tract infections. These are caused by endogenous native microflora of the patients. This infection can develop into complications such as orchitis, epididymitis, and prostatitis in males, and pyelonephritis, cystitis, and meningitis in all patients. The third one is surgical site infections. These are the second common type of nosocomial infections that mainly caused by Staphylococcus aureus, resulting in prolonged hospitalization and risk of death.
I'm going to tell you guys about on how to prevent nosocomial infection that mostly people not realize it. We usually think that we infected at the outside, but we also can get infection from hospital itself. Nosocomial infection can be avoided by standard precaution. Standard precaution is infection controlling set, which is used to avoid infection from blood, body liquid, or mucus transmit to patient. So what you can do is perform this step. Firstly, hand hygiene. Wash your hand. Okay, guys. Then personal protective equipment, or we call it as PPE, such as mask, glove, and goggle. Disinfection and sterilization at the hospital or surgical ward to make sure there is no microorganism that can be transmitted to other patient. Lastly, linen management, we can call it as housekeeping for hospital to make sure bed sheet, and clothes are clean.
You guys are just amazing. And I really hope that I will be okay as soon as possible. I think I should go now. See you guys next time.